Healthcare, while we want it to be the same, regardless of who you are, where you are, there are regional variances. There are differences based on what healthcare you've accessed before today, what healthcare access you'll need going forwards. And so having a local voice that really understands what's going on in that community is huge in healthcare. My name is Ankit Shah. I'm an emergency medicine physician here at Tower Health. My responsibilities are to be a clinical emergency physician. I'm also a clinical informaticist for the ED and urgent care. Healthcare and the healthcare map has changed dramatically due to the pandemic, where access to care has become dramatically limited. One of the ways a Department of Health can help with that is by innovating, helping to push programs through that can meet patients where they are. We have a wide range of patients that we have to treat. It's an up-and-coming phrase in medicine is tequity, where there are imbalances. There is not cell phone coverage or Wi-Fi signal out in rural communities, same as there is not downtown because of all the buildings, all the high-rises that are blocking signals. And so getting them the technology so they can access healthcare, whether they have access to transportation or not, and really trying to balance what the needs of the patient are, regardless of whether they come from a farm and have a kick by a horse type of an injury, or they're coming from downtown where they may not have had their diabetes managed for many, many years because they haven't had time to get off from work to go see a family doctor. Especially in today's volatile political environment, you put the words department and government together and immediately people think of Big Brother. The reality is a Department of Health is not there to dictate what you do, it's to provide guidance, it's to provide education. This is the best for what's good for the community as a whole. It's not about control, it's about what's right for all of us so that way we all can thrive, survive, and be as healthy as possible. Reading Hospital, and specifically the ED, is actually one of the highest volume emergency departments in the country. We are by far the busiest in the state of Pennsylvania, so we really serve as a base for patients. Whenever there's an incident in the community, they turn to us, and so we really serve that role in the community. In the ideal scenario, there would be a Department of Health that we could collaborate with during a pandemic where we have clinicians focused on patient care in the hospital, administrators in the hospital doing their best to get supplies to the clinicians at the bedside. Having a Department of Health focusing on management guidelines, policy changes, what's best to preserve the life and sanctity of all of our citizens, of our community here in Berks, and outlying communities as well, would be an ideal way to collaborate so we can do right for every patient.